Hello, everyone. My name is Dr. Marty Kotler. Thank you for attending this webinar on the ABN form, which is going to include information about the new ABN form. Little disclaimer, the information in this webinar is for educational purposes. It's not intended to substitute your thorough clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target coding does not provide legal services. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Let me tell you a little bit about myself before we get started. Again, my name is Dr. Marty Kotler. I'm a chiropractor, and I practiced for 16 years prior to starting my company, Target Coding. I am a certified professional compliance officer, certified billing and coding specialist, and my company has been helping thousands of chiropractors and their staff members for over 14 years. Now, I consider myself kind of unique because most chiropractors are not certified coders. Most certified coders are not chiropractors. So you'll see during this webinar how I combine the two specialties to make sure you're doing things properly, you're complying with all state and federal laws and rules, and you're maximizing reimbursement. Okay, let's get started. So let's just go over a quick overview of the different types of Medicare plans there are out there. This could be confusing to some doctors, staff members, even to maybe some patients. Medicare, there's Part A, there's Part B, there's Part C, also known as Advantage plans or replacement plans, Part D, secondary plans, supplemental plans. Wow, all these different plans. Let me tell you what the deal is. So Part A is when someone turns 65, person typically will automatically get Parts A and Part B from Medicare. Medicare is not an insurance company. It's funny, patients come into the office, you ask them what insurance they have, they go, I have Medicare. Technically, that's not correct because Medicare is not an insurance company. Medicare is a federally funded program. There are about 8 or 10 Medicare contractors, or I call them just Medicare insurance companies that cover all 50 states. So when you become 65, turn 65, your patients will automatically get Part A, which is hospital coverage, Part B, which are visits that cover Medicare patients going to doctor services and outpatient care. So here comes Mr. Smith. He walks into your office. He hands you that red, white, and blue card. That we're going to call traditional Medicare Part B. That only covers spinal manipulation. Some patients will walk into the office and go, yeah, I have Medicare, and they hand you a Medicare Advantage plan. You see a couple of samples on the screen. That's not Medicare Part B. That's totally different. Those are Part C Advantage plans. You're probably going to see more and more of those coming into your office. And then there are supplemental plans, which AARP is the most common. That'll pick up 20% of the traditional Medicare Part B allowed amount. And then we have secondary plans, which might pick up everything. Key points to Medicare Part B as far as chiropractic coverage goes. Yeah, chiropractic is covered into the Medicare Part B program, but only for spinal manipulation. No other payment is available. Even if you use an activator handheld device, Medicare doesn't pay extra for that. Medicare only pays for spinal manipulation. Medicare reimburses for 3 CPT codes, 989, 4041, and 42. Now, it's funny, Medicare requires examinations be performed by chiropractors, but they're not payable. Patient has to have a significant neuromusculoskeletal condition. Your adjustments have to have a direct relationship to the patient's condition. So Medicare Part B doesn't cover x-rays, modalities, therapeutic procedures, extremity adjustments. Any service besides spinal manipulation is not covered by Medicare Part B. So what do? You should be attempting to collect your full normal fee. Do not give away anything for free to Medicare patients. You can and should be collecting payment directly from the patient for these non-payable services. So I look at Medicare Part B patients as all cash patients. Many doctors want to go all cash. Everybody likes cash, right? You ever have a patient call your office and say, hey, Dr. Kotler, I'd like to come in for care. And you go, what do you have? Oh, I'm a cash patient. I don't have insurance. Do you ever say, sorry, we don't accept cash patients? You don't say that. Everybody accepts cash. So you want to look at a Medicare patient from a 30,000-foot view, it's all cash for Medicare Part B, except the spinal manipulation. That's the only exception. So here's a little Q&A. Can you treat Medicare Part B patients without submitting claims to Medicare? The answer is no. If you treat a Medicare Part B patient, you have to submit the claims to Medicare. Now, some of you may be hearing these things for the first time. Some of you could be looking at the screen like in shock. Do a little research. Contact us after. We'll give you the references. We'll show you the black and white reference data. If you have a consultant, ask your consultant. You're working with someone that helps you with Medicare, show them this information. If you treat Medicare Part B patients, you have to submit the claims to your local Medicare carrier. Can you treat Medicare Part B patients without being enrolled? The answer is no. If you're seeing Medicare Part B patients, you must be formally enrolled in the Medicare Part B program. If you're not allowed to touch a Medicare Part B patient. What did you say, Dr. Kotler? This is the typical questions we get, especially when we do our live seminars. When I bring up this slide, everybody's hand goes up in confusion. So hopefully this will make sense. We're getting to the ABN form. Don't worry, we're getting there very soon. Can you treat Medicare Part B patients without being enrolled? No, you must be formally enrolled. But Dr. Kotler, could I just see a Medicare patient for exams and laser? Medicare Part B? No, you have to be enrolled. Could I just do soft tissue manipulation and sell vitamins to my Medicare Part B patients without being enrolled? No. Can chiropractors opt out of Medicare Part B? No. Can you collect cash from Medicare Part B patients without billing Medicare? The answer is maybe. I'll show you how you could do that in a few minutes. So here, if you want, if you heard that and go, what? I never heard that before. I don't understand. Go to the Medicare Benefit Policy Manual, Chapter 15, and you'll see chiropractors cannot opt out of Medicare Part B. Actually, we get this question all the time. Dr. Kotler, I'm not in Medicare. I just have the patient sign the ABN form. 2 strikes against you right there. If you're not enrolled in the Medicare Part B program, you cannot touch a Medicare Part B patient. That's 1 strike. And now you're using an ABN form and you're not enrolled. Take a look at the 3rd bullet down on the screen. It says chiropractors not enrolled in Medicare Part B cannot use the ABN form. What? You might be going, what? I never heard that before. Go to the Medicare. Don't believe me. Don't believe anyone. Go to the Medicare Claims Processing Manual, Chapter 30, Section 50.3, and here's some information. It says chiropractors cannot opt out, noting that opting out and being not par the same are not the same things. If you want to see a Medicare patient, you have to enroll and choose par or non-par. And here, if you're not enrolled in Medicare Part B, this is what happens just about every week. We get a call from a chiropractor saying, Dr. Kotler, I heard your webinar, I went to your seminar, I've been treating Medicare patients, I'm not enrolled, what do I have to do? Okay, do you want to get enrolled? Yes. Now some patients go, oh, I just don't want to deal with Medicare patients. You're going to have very, very happy, wonderful, cash-paying patients that are 64 years old coming into your office, and then they turn 65. And if you're not enrolled, this is what you have to say to the patient. Happy birthday, patient. Now get out of my office because I cannot treat you. So many doctors are saying, all right, I'll get enrolled. So you need to fill out Form 855 and then Form 460 and then Form 588. If you don't want to deal with filling out all these forms, we can do them for you. So just a summary here, stop treating Medicare patients if you're not submitting claims to your local Medicare carrier. There are all the carriers across the country. Novitas, that covers New Jersey and Pennsylvania, Colorado, about 15 states, National Government Services, New York, Connecticut, Illinois, First Coast Service Options, Florida, Palmetto, Georgia. So there's all the Medicare carriers. So stop treating Medicare patients if you're not enrolled. You can't just tell patients, we're not in Medicare, just pay cash. You have to submit your claims to Medicare. Now, if you don't want to be enrolled, you don't want to deal with this, that's fine. Just tell Medicare patients, oh, we don't participate in Medicare Part B. We cannot treat you. Here's the name of 2 or 3 other chiropractors that you can go to that are enrolled. So if you want to get enrolled, we could help you. We do credentialing. A lot of people think what we do here at Target Coding is only provide free webinars. We do much more than that. We do credentialing. If you have an associate doctor you're bringing on, you need to do a revalidation to get the address switched to your address. If you're hiring a brand new, like my nephew just graduated chiropractic college, he's looking for a job. If he comes to your office, if he doesn't have a Medicare PTAN number, you're going to have to pay for it, or you're going to have to let the associate doctor deal with it. Fortunately, if my nephew comes to your office to look for a job, he's already got his PTAN. We took care of him. We got him enrolled. He came in as part of our new practitioner credentialing starter kit. Okay, now let's get to the new ABN form. By the way, ABN stands for Advanced Beneficiary Notice of Non-Coverage. ABN stands for Advanced Beneficiary Notice of Non-Coverage. So what does that mean? You need to tell the patient in advance before the service is rendered that it's not going to be covered. So here we go. Here's the new ABN form. You can get it online for free. Just Google new Medicare ABN form. Now, just a quick review here. If you have been using the Medicare ABN form properly, then just use the new one. The only thing that will change is the expiration date in the bottom left corner. The bottom left corner, the expiration date now says expires June 30th of 2023. It used to say 3/2020. So the new ABN form becomes mandatory on January 1st of 2021. Originally, it was August 31st of this year, but that got updated. It's January 1st of 2021 is when the new form becomes mandatory. However, we're training our clients, just start using the new one right now. So again, if you have been using the Medicare ABN form properly, you're now going to use the new ABN form. The only thing that changes is the expiration date in the bottom left corner. If you're using it properly. Many doctors are not using it properly. So let me show you how to use the ABN form properly, and then just slip in the new ABN form. Again, the new ABN form becomes mandatory on January 1st of 2021. However, you could start using it today if you would like. The old one said March 2020. The new one in the bottom left corner, it says expiration date June 30th of 2023. So the ABN form is a mandatory notice that you must provide to a patient before providing a normally covered service. This informs the patient that this normally covered service, like spinal manipulation, is now not going to be covered. The most common reason is maintenance care. So if your Medicare patients never get to the point where they get to maintenance care, then you don't need to use an ABN form. You have to still be enrolled, but you just don't need to use an ABN form, because if you've been treating the patient for active treatment, you submit the bills and you get paid. We narrowed it down to basically two forms that are important for your Medicare patients. On the first visit, have the patient sign a form. We recommend you just take out your letterhead and just list all the things that are not covered. Have the patient sign the form. You could use an ABN for non-covered services if you want, but I don't think it's a good idea. So first visit, let them know exams, x-rays, therapies not covered. If they get to the point where they get to maintenance care, now some chiropractors are terrible at converting patients to maintenance care. I was okay. My conversion ratio was 40%. So basically every 10 patients that came into my office with insurance, after the insurance ran out, 4 out of 10 stayed with me for maintenance care. 6 went, bye-bye, I ain't coming in if my insurance doesn't cover. So I was at a 40% conversion ratio. Some of my clients, they're like 95% of their patients, they're great at converting to maintenance care. So you're going to be using this ABN form a lot. Some of my doctors are terrible at converting patients. Some of my clients are 100% PI, so they don't have to deal with this ever. So maintenance ABN is required. So you could use just on your letterhead, you could say Medicare doesn't pay for exams, x-rays, extremity adjustments, modalities, orthotics, decompression, laser, computerized range of motion. Whatever you do, except spinal manipulation, you could put on this form, or you can use the ABN form for non-covered services. There's information on this slide that talks about how an ABN form for non-covered services is not mandatory, but if you want to use it, you can. We don't recommend you use an ABN form for non-covered services. And here's the ABN form for spinal manipulation. So you get to the point, I call it like the good news, bad news visit. Good news is, Mrs. Jones, you've reached wellness. The bad news is Medicare doesn't cover it. Would you like to keep coming in? Some patients will say no. If the patient says yes, you go, okay, Mr. Miller, wait right here. Now your CA can come in and explain the ABN form, or the doctor says, okay, Mr. Miller, just to confirm, you understand Medicare will not cover maintenance wellness care. Patient verbally says yes. Do you understand that you have to pay cash? Yes. Do you understand the fee? Yes. Are you sure you want to come in for maintenance wellness care? Medicare doesn't cover it. Yes, Dr. Kotler, yes. Great. Then show them the form. The top of everything you see in green you need to fill out. So your name and address across the top, the patient's name where it says patient name, identification number, I would leave that blank. And then it says services, chiropractic spinal manipulation for maintenance care. Reason Medicare won't pay? It's because Medicare doesn't pay for chiropractic manipulation for maintenance care. Estimated cost, you must put in the amount. If you're off a little bit, it's okay. Medicare gives you like a 25%, or I think it's $100 range. So you could put in a range or put in exactly. If you charge $40 for a chiropractic maintenance adjustment, put $40 in the estimated cost. Or let's say you vary from a 98940 to a 4142, from $40 to $60. You could put in a range depending upon how many regions you're going to adjust, but you have to put in the amount. Can you charge the patient your normal maintenance fee once they get to maintenance? I'll answer that in a minute. But you need to treat Medicare patients just like everyone else. Here's another common thing we see that's done incorrectly. Medicare patient gets the maintenance care. Okay, Medicare patient's maintenance, it's 30. Everyone else is 50. Or everyone else gets charged $40 for electrical stim. We bill PI $40 for electrical stim. When Medicare patients come in, we only charge them $5 or we give it away for free. Bad process. Billing managers, if you're doing that, stop. Office compliance managers, stop doing that. If you're doing that, have a training, have a meeting with the doctor. And then the patient has a choice. Option one, I want the maintenance care. You may ask to be paid now, so that answers the question. That's another question we get from CAs. Could we have the Medicare patient pay for the maintenance adjustment right at the time of service, or do we have to wait? You do not have to wait. It says it right on the form. It also says, I want Medicare billed. Okay, so option one, that basically the patient is saying, even though I understand this is not going to be covered, I still want you to bill Medicare for denial purposes. That's option one. Not a big deal. Submit the claim. You're going to change the AT modifier to GA. It'll come back denied just for, I guess, satisfying the patient. Or option two, I like option two better. It says, I want the maintenance care, but do not bill Medicare. The patient is telling me, do not bill Medicare. This is another thing that I get, sort of upset when I hear other consultants or other, quote unquote experts say, even if the patient checks option two, you must submit the claim to Medicare. I don't read it that way. Option two says, do not bill Medicare. I'm just following the patient's directive. So there's the ABN form. Now, some of you could be non-par, not accepting assignment, which is what many doctors that are very, they're not that excited about being enrolled, but they do it anyway because they know they have to do it right, and they know that their 64-year-old patients are going to get Medicare, and they want to do it right. So some of those doctors that hesitantly become enrolled, they want to be non-par, not accepting assignment, which means they want the Medicare patients to pay at the time of service. If your normal fee is 60, here's where you have to abide by the Medicare fee schedule, even if you're non-par, not accepting assignment. So if that's the case, non-par, not accepting assignment, you have to change the ABN form a little bit. You'll see option one, the last line is crossed out, and then additional information. It says this provider does not accept assignment from Medicare for the items listed above. I am responsible for paying the provider's charged. If Medicare does pay, Medicare will pay me, the patient, the approved amount, which could be less than the provider's charge. So here's the big question we get. Can you charge, if you normally charge all your patients for maintenance wellness adjustment, $70, can you charge that to your Medicare patient once they get to maintenance? Yes or no? What have you heard? What have your friends told you? If you went to your state association convention, what did the speaker say? The answer is yes. Can you charge your normal fee? Now, you may have heard this differently. Don't believe anyone. Go to the Medicare Claims Processing Manual, section 50.7.3. It says if the patient has been given a properly written ABN form, you can charge your customary fee. Medicare modifiers, there's a few here, not that many. AT, GA, GY, GP. So 98940 AT means active treatment. 98941 GA, that means the patient checked option 1. They wanted you to bill even though it's going to get denied. If you do an exam on your Medicare Part B patients, I think it's a good idea to use the typical 25 modifier if you do something else on the same day. And the GY means not covered. So that can go in if the patient has a secondary insurance. Maybe the secondary plan will pick it up. That's the only way it'll get paid by an insurance company if a Medicare Part B patient has secondary coverage. If they have supplemental, it's not going to cover the exam. So if it's supplemental or the patient doesn't have a secondary at all, you don't have to bill Medicare for non-covered services. But some doctors do it anyway just because it's a routine, which I'm okay with, but understand you have to write it off once the denial comes in. And then we have 97140 manual therapy. Does Medicare pay for that? No. Medicare Part C Advantage plan might pay for it. Medicare Part C Advantage plan might pay for 99203. We have some doctors billing Medicare Advantage plans. They're getting paid for everything: exams, x-rays, diagnostic testing, orthotics. Some Medicare Part C plans mimic Medicare and only pay for spinal manipulation. A little bit about billing and coding and OIG compliance. So a lot of people get confused between HIPAA and OIG. The main purpose of HIPAA is to protect patient health information, like their names, their addresses, their credit card number, their social security number. That's the main purpose of HIPAA, to protect patient health information. The main purpose of OIG compliance, also known as billing and coding compliance, is to prevent billing and coding errors. HIPAA doesn't focus on preventing billing and coding errors. OIG doesn't focus on HIPAA. So make sure you understand the difference between these two. So if you are seeing Medicare patients, I'm assuming most of you listening to this, you logged in because you see Medicare patients. So if you do, you're required to have a billing and coding OIG Medicare compliance manual. Again, one of those things where many of you are going, what? Nobody ever told me that. Yeah, I know. I think I'm famous or maybe infamous for saying things, and people go, what? I never heard that before. Um, so Medicare and all health insurance companies want providers to be proactive. How do you be proactive? Have written billing and coding policies and procedures. And you could do this yourself. You don't need to hire anyone. Office managers listening to this, office managers put together billing and coding policies and procedures. You should be able to do it on your own if you have some experience. If not, ask the doctor to help you. If the doctor can't help, nobody could help, then seek outside assistance. You can contact us or contact anyone. There are tons of companies that supply billing and coding Medicare compliance manuals. Ours is very simple. And as I mentioned before, most chiropractors are not certified coders. Most certified coders are not chiropractors. So the materials that we sell, the webinars and seminars that we put on, resonate with a lot of doctors and staff members because we make it simple and practical because we have those two specialties. So a billing and coding policy and procedure manual, it should have these three essentials: policies and procedures, perform record reviews, and conduct regular staff trainings. So I'm going to show you a couple of policies right out of my Medicare billing and coding policy and procedure manual. You can copy these. The first one is record reviews. The backbone of any compliance plan is reviewing patient records. So your policy is to perform periodic reviews. What's the procedure? You're going to look at, we usually take 5 to 10 charts every 4 to 6 months. Here's another policy, staff training, 3 hours per year. Document that in a spreadsheet. Here's another policy, exclusion list. Here's another one that most of you are going to go, what? How come nobody ever told me this? If you see Medicare patients, you are required to go to the exclusions list. You see the website right here, exclusions.oig.hhs.gov. You are required to go to this website and put in the names of anyone, even staff members, even your front desk CAs, anyone in your office that has anything to do with Medicare billing and coding. You need to put that person's name into this exclusions list to see if they've been excluded from the Medicare program. What, Dr. Kotler? What did you say? My front desk CA that just stuffs envelopes and does filing? No, I didn't say that. I didn't say your front desk CA that just does filing needs to do it. Does your front desk CA take copays over the counter from Medicare patients? Then you need to put that person's name in the exclusions list. Does your front desk CA enter CPT codes into your EHR on Medicare patients? Then you need to put that person's name in the exclusions list. Do you have any staff members in the back? Maybe you have a CA assisting with Medicare patients. Well, you need to put that person's name. You have an associate chiropractor adjusting patients. Well, you need to put that person's name into the OIG exclusions list. You have a billing company you deal with. The list goes on and on. So here's an example. Dr. Douglas comes to your office for an interview and you want to hire him to see your Medicare patients. Seems like a great guy, but wait, you put his name into the exclusions list, he's excluded. He's not allowed to see your Medicare patients. And there are some other companies, I'm pretty sure American Specialty Health, ASH, requires that you do this every month. Here's another one. This is a chiropractor. She comes to your office. Dr. Anderson, she seems like a great chiropractor. You ready to hire her? Wait, put her name into the exclusions list. Oh, she's excluded. She didn't pay her student loan. That's one of the most common reasons why I see chiropractors kicked out of the Medicare program because they didn't pay their student loan. This is what you want to see. Put the patient's, the doctor or staff member's name in here, and it comes up, no results found. This is what you want to print out, scan into your computer, and have it digitally or print it out if you have a paper. When we provide our OIG compliance manuals, we give you both the actual 3-ring binder with all the pages for the doctors that still like hard copy paper. And then we also give you all the manuals, all the forms, all the templates digitally. We cover both bases. You get both. And in your policy, you should have something on copays and deductibles and coinsurance. Is it okay to waive copays, deductibles, and coinsurance? The answer is sometimes it's okay. Do you have a policy on that? What happens if a patient has a $30 copay and they miss 3 appointments? Now, I'm sorry, they show up for 3 appointments, but they forget their checkbook at home. So now that's $90. Now the patient disappears and you can't find the patient. You send the patient a statement, you call, patient's disappeared. You have to write off. That's one example of where it's okay. There are many examples where it's okay, but routinely, you can't waive copays and coinsurance. Here's what I know one doctor does. He's got Bank of America right next to his office. There are 300 employees that work for Bank of America in this office, all administrative people that's sitting at a computer all day. So he's told all of these employees, and they have great insurance. They have, I don't know if it's an Aetna plan or a Cigna plan, pays 80% of everything. It's one of those great plans. So what he's done is he's told all 300 of these employees, he's been able to get through to all of them and let them know that he's willing to accept the insurance as payment in full. He's not collecting deductibles or copays. Well, guess what? He just got a letter from, I don't know if it was Aetna or Cigna, asking for proof that he's collecting copays. So that's a routine waiver. Can't do that. Another doctor says, well, teachers, all my teachers that come in, I don't collect the copay. I feel bad for teachers. They don't make enough money. They don't make that much money. That's a routine waiver. Can't do it. What's your policy on discounts? My normal fee is $100, but Mrs. Jones, it's only 40. You have a policy on that? Do you know what the rules are? What about free exams? Oh, my Medicare patients, they come in, I give them a free exam. What's your value of a free exam? As I said, you should not be giving away anything for free to your Medicare, for anyone. I don't recommend you give away free services to any patient. There, this doctor was giving away free stim to his Medicare patients, and he got fined $80,000. Whistleblower, somebody called in. Now, an office policy prevents whistleblower issues. What do I mean by that? Here is an example. This is not a chiropractor's office. This is some office in Tennessee where they were billing modifier 25 improperly. It resulted in a $1.5 million penalty against this office. There was a whistleblower. Somebody, was it a disgruntled staff member? Was it a unhappy patient? Was it a jealous doctor down the road? Somebody called this in. And the whistleblower, the person that called in the complaint, received $270,000 reward. You want to look it up? You could check it out. So here, this one also was a whistleblower. So your billing and coding policy and procedure manual prevents this. You might say why. I'll tell you why in a couple of minutes, or tell you how it does. How does Medicare investigate fraud? Like, how did they even find out, right? So obvious cases for billing, of course, for fake patients, but sometimes doctors and staff members, they bend the rules to make the patient happy. They exaggerate the severity of the condition. The patient has mild neck pain, the doctor's putting in a herniated disc in the neck. They're changing the diagnosis. Disgruntled employees, unhappy patients, these could cause havoc to your office. Having a billing and coding policy manual prevents it. How? Because your staff are all going to sign a form that they understand your billing and coding policies and procedures. So if they break it, it's their problem. We had just a doctor, a little bit of a side note, a doctor called us and said, one of our clients said, one of his CAs quit, has taken some proprietary information, has taken some patient emails, has left the office, going to work for another chiropractor. So fortunately, this doctor listens to us and he had the patient sign the office policy and procedure. And section 5, line 7, it says, if you leave this office, you are not allowed to take any of our information. And if we find out that you did, you are subject to penalties, fines, and it gives specific. Then there's another section of the policy. It says, if we find that you have done things that violate this office policy and procedure, you are subject to this. So now he's going after this CA and she's in big trouble because she stole information from the office. He could call the police and have her arrested for stealing information, but he's not doing that. He's taking more of a soft approach. So here are if you're looking for statistics, a lot of our clients are into stats. So here are some stats. These are the most common billing Medicare errors, most common Medicare billing and coding errors. Your exam, missing or incomplete, 35% of the time. Diagnosis codes, 33%. Treatment plan insufficient, 83% of the time. Medical necessity, 67%. Not addressing contraindications, 66% of the time. So there's prepayments, there's post-payment audits. Prepayment audits are on the rise. Here's a doctor needs to give back $250,000. This is not Medicare, this is a Cigna plan. Many of these prepayment audits, this one is like a little blessing in disguise. You get caught for some reason with horrible notes. The insurance company could ask you for money back right on the spot. They could possibly ask you back for tens of thousands of dollars, maybe even hundreds of thousands of dollars. My biggest case I was involved with, $17 million an insurance company wanted back. That's unusual. But some insurance companies, they go easy on you. They say, you know what, we could ask for money back, but we're not. We're going to put you on a prepayment audit. So when you send in your bills, you have to send in your notes. So that can cause some issues. Some of you might be getting records requests from Inovalon, Ciox, some of these companies. This is not an audit. It's just a standard review. And the reason why they do it is because health plans that have a greater number of healthier patients, they have to give money to insurance companies that have a greater number of sicker patients. So prevention is the key. That's what we talk about all the time. Prevention, proactive. So here's just a few closing comments. Get proactive. Make sure the patients fill out all the forms. That's step 2. That's for the staff. Step 3, doctors review all the paperwork prior to seeing the patient. Step 4, review the policies. You review the policies from the insurance companies you bill the most. Doesn't that make sense? I have a client, he collected $700,000 a year. He collected $700,000 last year, probably going to collect about the same this year, maybe a little less because of Corona, but $700,000 he collected from Cigna last year. You think they're looking at him? You think they're watching him? Of course. Every 6 to 9 months, he gets a request for records. Very rarely does he have to give money back because he has all his policies and procedures. He reverse engineers their policy. Whatever the Cigna policy says on chiropractic, he follows to the letter, and that's what I teach him. Every year I go to his office, I do a training. He's got 9 associate doctors. So we train once a year and we stay on top of him. So he's not worried because he's got protection. Step 5, understand the what and the why. What are what your CPD codes are doing? Why are your diagnosis codes? Do a self-test on your SOAP notes. Step 7, always keep learning. Appreciate you all listening to this webinar. You should always keep learning how to help more patients, improve your business. Step 8, I've hit this point. You need to put together a simple billing, even if you don't see Medicare patients. It's for your protection. The patients don't see this billing policy manual. This is for your internal use for all your staff members. So if there's a problem, you're covered, doctor. This is about covering yourself and protecting yourself. That's what we do with target coding. Our goal is to protect the doctor, not necessarily the staff. It's to protect the doctor, not necessarily the patients. It's to protect the doctor. Step 9, conduct regular staff meetings, again, to protect the doctor. You have a billing company, do a spot check on your billing company. So you want to do all these things so you could SWAN. That's my favorite acronym, SWAN, which means sleep well at night. Stay in touch with us. Go to Facebook. Go to Instagram. Follow us. Go to YouTube. If you really like this webinar, show it to your staff members. This is going to be uploaded to our YouTube channel after we're done. You could watch it again. There's our contact information. You know how to contact us, right? You have any questions about this? Email us for a free consultation. We offer free consultations on this topic or any topic regarding chiropractic, billing, coding, documentation, software, Medicare, HIPAA. By the way, we always get the question, what software do you recommend? We recommend Genesis Chiropractic Software. We don't recommend any other company. We recommend Genesis Chiropractic Software. Contact them. We've created macros for their software, quick shortcuts. All right, we're going to go to questions and answers now. Oh, by the way, we offer a compliance program, which includes HIPAA, OIG, and OSHA. We do all the heavy lifting. Shop around if you're looking to bring on a company to do a compliance program for your practice. Shop around. You're going to find out something that we charge more than everybody else. Yes, we charge more than everyone else. Why? Because we do more. We do all the major heavy lifting for you. Toyotas, Hondas, I love them. They're great cars. We don't sell Toyotas and Hondas. We sell Mercedes, Ferrari, Rolls-Royce, Tesla, and I don't know what other car is great. Ferraris. Here are some testimonials. Yes, we have a lot of happy clients. What else do we do? I have a book that I sell. It's an excellent book. It's a book on the best chiropractic CPT codes and diagnosis codes to improve reimbursement. One of the best part, one section of the book is on pairing. Just like you pair food and wine, or you pair peanut butter and chocolate, I'm going to pair your procedure codes and your diagnosis codes like this. Mechanical traction pairs beautifully with cervical radiculopathy and disc degeneration. Myofascial release pairs amazingly well with a 1996 Chardonnay, no, with myofascial pain syndrome, M7912. See, there's sommeliers, they're wine and food experts. I'm a coding sommelier. I'll pair your CPD codes and diagnosis codes. Oh, you do therapeutic exercises? Beautiful. Pair that with what? Neck pain and stiffness. How about an adjustment? Let me show you how not to pair. You do a chiropractic adjustment, 98940, and you pair that with M9906, a knee subluxation. Automatic denial. That tastes terrible. You don't pair those two. So in the book, it shows you how to pair your codes. It also shows you the codes that pay for the most visits. There's 3 sections of the book. Section 1 is on pairing. Section 2 is on showing you the codes that pay the most visits. Section 3 is about how to substantiate your codes, and you get a whole bunch of these cheat sheets. What else do we do at Target Coding? We also have a CA boot camp. We've covered every single possible job description any of your CAs could have in our CA boot camp, from front desk and patient relations to billing and collections, helping you, office managers, right? You might want to sign up for this. Module 3, many doctors have their CAs helping in the back with the stim, with the hot packs, with the exercises, and actually entering the notes. And then we have module 4, which is all about how to run an office. We do billing. Yes, Target Coding does billing. Let us know. We charge 7%. That's the start. Something unique and interesting about your practice, maybe we'll go down to 6%. Or maybe we'll charge you 8%. I don't know. You got to have a consultation with us. Let us know what you're doing, and we'll tell you. But we start at 7%. Outsource your billing to us. Outsource your credentialing to us. You need forms? We have, now you could have, even if you have ChiroTouch, whatever software you have, you still need forms. Like what? Hardship forms, ABN forms. What happens if you're getting denials? We have these great fight back letters. What about if you need a letter of medical necessity for a back brace, a TENS machine, a Varidesk stand-up desk? You want to see some sample soap notes? You need Medicare forms? You want sample Medicare soap notes? They're all in here. How about HIPAA forms? You need HIPAA forms? The HIPAA forms include the training, the employee training forms. They're included in there. Also, telehealth forms. You might still need to be using some telehealth forms if you're doing telehealth. You need help with ASH? 2 things people need help with ASH. 1, how to get more visits out of ASH. And number 2, how to get more cash out of your ASH patients. That's what we focus on. We could do a live training for your office. Me or one of my certified coders will get together with you and your staff, put everybody into one room, surround around one computer, and we'll show you what the deal is with ASH. We could do that with Medicare too. And we could also do it with how to transition your insurance patients to cash patients. We have memberships. Eventually we'll do seminars again. So again, I want to thank everybody for attending. I hope you learned a lot. Let's go take a look and see what questions have come in.